Well, first of all, nice to see you all. For those of you who haven't met or haven't had a chat with, my name's Susan. I'm one of the Trust medical advisors, and today we're going to be talking about foot health and looking after our feet as we age. So, the things we're going to cover today, we're going to just cover some common foot conditions, bit about arthritis, what the relationship is actually with balance and arthritis, some common foot conditions like athlete's foot, dry feet, looking a little bit at diabetes and how that affects the feet, what good foot care is. And we've got Jenny here, who is a former podiatrist, and hopefully she and I will be answering the questions at the end. Just to say, there were a couple of questions about specific exercises, strength exercises and ways to improve flexibility in the feet and ankles. That's probably a little bit out of my area of expertise, but we have a webinar coming up with Fraser, who's a physio who we've worked quite closely with in the Trust, and he's doing a webinar in May, and he'll be able to discuss those kind of exercises in a bit more detail. So what I'm going to do, I'm going to forward those particular questions on to Fraser, and I'm sure Annabelle will circulate the details of that webinar a bit closer to the time, but I think it's in May the 17th as far as I'm aware.
That's right, yeah.
Perfect. So the first, I guess, area I wanted to cover is just a little bit about arthritis. So osteoarthritis is the most common type of arthritis, and you can get it in any joint in the body, but you can get it in the feet and ankles. The foot alone has it has 33 joints, all potentially which can be affected by arthritis. Now, as we age, your body goes through a normal cycle of damage and repairing these joints, and this process goes on constantly. However, sometimes as we get older, these processes that begin to repair our joints can alter the way the joints, the structure of the joints, the way they look and the way they function. We can get wear and tear changes where the cartilage, which is some protective tissue at the end of the joint, begins to get worn away, and the space between our joints begins to decrease. We can also get little fragments of bone and cartilage breaking off in the spaces between our joints, and these can cause pain and swelling. And all of these changes are what we call osteoarthritis or arthritis. But why is that sort of more important for us to know about? Well, if you are upper limb affected and you use your legs as arms, you're more likely to get wear and tear changes in the feet and ankle simply because you're using them more. There may also be some damage to those bones caused by thalidomide, which can contribute to early arthritis. Also, if you've had previous falls, previous fractures or previous injuries in the foot and ankle, that can also make arthritis more likely. So how do you know if you've got arthritis? Well, you can feel it. You might feel pain. You might feel swelling. The joints might feel particularly stiff, especially if you haven't moved them for a while. The joints may look bigger, or someone may comment that your ankle or foot joints look bigger. You actually might be able to hear the changes. You might hear crunching or grating sounds as you move. You also might find that the ankle feels maybe a little less stable, that there's some weakness in the ligaments and your ankle gives way. You also may notice that your balance is more affected than usual and you may feel more unsteady. So there's a really, really strong link between balance and arthritis. Because the foot and ankle are shock absorbers, they provide support, they tell our bodies where we are in the world. And if you've got pain, stiffness or inflammation in the feet, that can affect the way you move your foot and ankle. That can also have a knock-on effect on your hip and knees, on the way you walk, and lots of research has linked joint pain to an increased risk of falls and for problems with our balance. And the more arthritis we have in a greater number of joints, the greater our chances of having a fall. And actually, researchers say that pain makes us use the joint in a different way, makes us distribute the weight differently, and can make us more unstable and make the joint not function as well. So actually, that's why professionals like physiotherapists and podiatrists are really, really important to do things like gait analysis. So analyze the way you move, to provide appropriate foot support, and also to show exercises to strengthen the muscles, ligaments, and tendons around the foot and ankle. So as I said, there's a really strong link between balance and arthritis in the foot and ankle. So I'm just going to just mention specifically about falls because it's a really important topic, especially as we get older. A really good physiotherapist can do a falls assessment, so can assess you and look at risk factors for falls and help minimize this. If you're feeling more unsteady recently or you're worried your balance is affected, it's actually a really good idea to have a chat with your pharmacist or GP and just run through your medications, make sure there's nothing that's making you dizzy. And also, if you're taking strong painkillers for arthritis, things like tramadol, cocodamol or codeine, again, these can make you more imbalanced and more likely to fall. So it's a really good idea to review medications if you're worried about your balance. It's good to think about your home environment and, fall proofing it if you like. So just making sure that if you are more imbalanced, if there is, you're having problems with arthritis, that you're making your home environment as safe as possible, that you're cleaning up any trip hazards, wires, piles of books, clothes, non-slip mats are there, and actually making sure halls and stairs are really well lit. Now, in terms of, I guess, I'm not going to talk about too much here about specific exercises because, as I said, I think Fraser's probably a bit more well placed to talk about this. But actually, anything like Tai Chi, yoga, physio-led Pilates can really improve our coordination, balance, increase flexibility, and help protect the tendons and muscles and ligaments around joints. So, if you're worried about arthritis or if you think you have arthritis, well, the first thing to do really is to have a chat to your GP, or you can chat to one of the trust medical advisors. Sometimes we'll do an x-ray just to confirm those changes. If you've got really severe symptoms, they may do more detailed scans like an MRI or CT. But there are different things we can do to treat foot and ankle arthritis. One of the things actually to look at is our foot care and insoles and inserts, because these can help relieve pressure on the painful bits in our feet. They can help cushion our feet and they can actually ease the pain as we move. You may also find that something like a brace or a support for your ankle helps with things like stability. And a podiatrist can also help advise you on things like this. Now you can buy some cushioned insoles just from shops to put in your shoes, but I would always sort of recommend seeing maybe an orthotist who specialises in splints and supports if this is something you want to explore, just so you're getting something that's custom for you and fits your body. Now, with arthritis, it's obviously a painful condition and you can treat it with painkillers, and they can be just simple ones you get over the counter, paracetamol, or things like ibuprofen, which can help with pain and stiffness. Now, ibuprofen is a type of drug called an anti-inflammatory drug, and it does just that. It reduces the inflammation. And as I said, you can get that from the chemist. If the pain is severe, you may want to explore stronger non-steroidals with your doctor. And they might be things like naproxen or celecoxib. Some people actually find, though, that the non-steroidals are best actually in a gel form. So that can be a cream or a gel that can be rubbed onto the affected area. But what is really important to say is that if you're taking tablets like ibuprofen, and you take them in the gel form, you do need to speak to your doctor or pharmacist, because usually you can't use them both at the same time because you'll be getting a double dose of the medication. So do check that out with a pharmacist or a doctor if you're unsure. And I'm sure Jenny will agree that sort of good footwear here is really, really important for actually general foot health. So we need to think about really supportive footwear. We need to think about footwear that's made of a material that allows your skin to breathe, so doesn't allow your skin to get moist or damp and then make it more likely you'll get fungal infections. You want a deep and roomy toe box at the front of the shoe so that you're not getting those toes squeezed together, you're not getting the pressure on those joints. You're looking to get really a light rubber sole, which is good for grip, and something with a secure fastening across the top of the foot, like a buckle or a Velcro strap, to secure the shoe, and so it's comfortable. And the one thing I would just say, just be really careful with slippers at home. Anything that you slip on, they're a really, really big fall hazard, and lots of falls are caused by slippers, especially the ones that don't have the backs to them, the slip-on kind. So good footwear is really important here. There are other things you can do if you've got sore or painful feet, and these are just simple things you can do at home. And you can use things like heat pads or ice packs. So you may find even just a hot bath might be quite soothing if you've got pain and inflammation in your feet and ankles, or alternatively an ice pack, or even just some frozen vegetables wrapped in a towel placed on the skin. The one note of caution I'd add with both of these things, if you have a condition like diabetes or you have changes in sensation in your feet, you may not feel the heat and cold as much, so you might be more at risk of freeze injuries and burns. So just make sure if you're using an ice pack, you're not putting it on bare skin, you're not leaving it longer than 20 minutes, and actually just wrapped in a tea towel or towel is a really good idea. And again, the same with the heat packs, not to use it for prolonged periods of time if you've got altered sensation in your feet. If you are getting a lot of pain and inflammation in your feet, and you use a feet for lots of activities, then actually a tip is to pace your activities, to spread out the things you need to do during the day rather than doing them all in one go. And I know this can be actually really difficult, but minimizing anything that aggravates the pain and preserving the feet for the essential things that you need to do or the things you enjoy to do, and using aids or personal assistants or carers where possible to do anything else you need to do with the feet, so that you're preserving the function in the feet as much as possible for the things you need the feet to do. Now, if you're trying all these measures and they're not helping, that's a sign that we can consider things like a steroid injection. So steroid injections can be given by physios, they can be given by surgeons, they can be given by GPs, and they reduce the pain and inflammation within a joint. They don't last forever, they only last a few months, but you can have them repeated. And again, if the pain is not being controlled, there's something that's worth considering. I'm not going to spend too long on this side. This is just saying there are surgical options if the pain and arthritis in your feet and ankles is severe, but we'd recommend an assessment with a really, really good orthopedic surgeon before surgery is considered. So if this is something you want to explore, please speak to one of the trust advisors and we can recommend someone to go to. So it's sort of a bit of a whistle-stop tour through common feet problems, just because there's so much to consider. You may find that you have sweaty feet now. So moving on from arthritis, we know sweating can be a real problem in the community, and the fancy name for it is bromidrosis, and that is when the feet get very wet and begin to smell. And that can be caused down in a breakdown of the skin. And that's when the feet are in constantly moist conditions. So it's really important with this to wear clean, breathable socks, something like cotton, daily washing of the feet, and actually alternating the footwear that you're using so that one pair dries out while you're using another pair. And the idea is that you're keeping the environment of the foot as dry and clean as possible. And there are some really strong antiperspirants, especially for the feet, that you can get from the chemist if you find that this is a problem. So I can't talk about the feet without talking about diabetes. So it's really, really an important topic. So the NHS health check is something that is offered by the NHS every 5 years, and it includes a screen for diabetes. So if you haven't had a recent screen for diabetes, I would ring up the practice and ask for one. And if you're having any difficulty, we can help. And if you do have diabetes, it's really important to go for your annual check and your annual foot check, where they check for sensation issues. So diabetes is raised blood sugar. And if diabetes is left untreated, or if the diabetes isn't well controlled, then over time, the high levels of blood sugar can begin to cause damage to the nerves and the blood vessels in the feet. And over time, this can cause reduced blood flow and reduced sensation. So it's incredibly important, if you have diabetes, to check your feet daily. And you really need to get to know what your feet look like usually, so that you can notice when there are any changes. Or you might have to get someone to do this for you, because you need the in between each toe to be looked at. And actually, one way to look at the soles of the feet might be to use mirrors. But as I said, if you're unable, it's important to get someone else to check, to look for changes in the skin, any ulceration, any skin breakdown, any signs of infection. If you have diabetes, these infections might be a bit harder to treat. So if you're worried about an infection, a cut, an injury that's not healing, it's really important to see your GP, practice nurse, or podiatrist for an assessment. Because, as I mentioned, diabetes can affect the sensation in the feet. You actually may not feel it if you have an injury or if you knock yourself. So daily checks on the feet are really, really important. And if we think a little bit about good foot health generally, so this is for sort of everyone, then there are some basic rules we can follow. So we want to keep our feet clean and dry, especially between the toes. But rather than rubbing between the toes, we just want something to dab in between the toes so we don't break down the skin. It's really important to get to know what your feet look like, what's normal for you. And then you can notice if there's any change in colour or shape or redness. And again, you might want to get someone to examine your feet for you. And if it's difficult to look at the soles of the feet, you can, as I said, use a mirror. But there's some basic things to do, including good nail care, so keeping your nails short and straight to reduce the chances of ingrowing nails. And you may want to use a nail cutting service for this if it's difficult to do at home. You want to make sure that any ingrown nails, verrucas, ulcers are treated very early, especially if you have a condition like diabetes. Applying moisturizer is going to be really important if you want to keep the skin from cracking and to improve its texture. But there's also some general health things we need to do to protect our feet. So we want to check our blood pressure. We want to have a screen for diabetes, like I've mentioned, and we want to check cholesterol, because these are all things that can affect blood supply to the feet. They're also important just for general health anyway. And again, actually, if we smoke, we may want to be thinking about stopping smoking, because again, we can get the hardening of the arteries over time and reduce blood flow to the feet. If you're worried about weight, it might be a good idea to chat to one of the medical advisors or your GP, because actually, if you can release some weight, you can reduce the load going through that foot, and that can really help with arthritis. You can also eat for your feet. So actually what you eat has a really important knock-on effect on your skin, your tissues, the way they heal. So the best diet, and you've probably heard me mention this before, is a Mediterranean diet. So you want a diet rich in fiber, in fruit and vegetables, in nuts, in healthy fats, because that's going to give you the vitamins and minerals you need for healthy skin, immune system, and healthy joints. So there's various things we can do really to keep our feet healthy. But if you, as I said, if you're worried about any changes in your feet, they're more painful, you're worried about an infection, you're worried about skin changes, then always just get someone to have a look. And as I said, that can be a GP, practice nurse, or podiatrist. So we actually got some questions that were submitted in advance, which I thought we could go through, and then see if there are any other questions that crop up. Um, so let's just moving on. There was a couple of questions regarding athlete's foot and fungal nail. So I thought I'll start off, but Jenny, feel free to chip in if I haven't said something correctly or if you've got something to add. So as I said, we had a couple of questions about athlete's foot. So what is athlete's foot? Well, it's probably the commonest fungal infection affecting the skin on the feet. Now, this fungus loves warm, moist places like the feet, and especially in between the toes or in the little creases of skin, because that's where it's more moist and warm. And how you know you've got athlete's foot is that your skin will become itchy, dry, cracked, and you may notice little bumps or white patches. So because the fungus really likes moist conditions and warm conditions, we've really got to keep the feet clean and dry. So it's really important we need to dry the feet well after washing them, especially between the toes. But as I said before, it's really important not to rub too vigorously between the toes. We want to dab rather than rub it because we want to protect the skin. You also want to use a separate towel for your feet and to wash that regularly. And if you can, to take your shoes off at home, just to air the feet and to make sure they're as dry as possible. And to change your socks every day, and cotton socks are probably the best. You can get lots of antifungal creams, powders and sprays just over the counter, and your chemist can give you details of these. But the most important thing, and this is probably where some treatment can fail, is that you use the creams and sprays and the athlete's foot clears up. And when it's cleared up, you stop using it. But actually, the most important thing is to continue treating for another couple of weeks, even after the rash and the symptoms have disappeared, to get rid of the fungus completely. And again, a similar fungus can affect the nails, and you may notice this is what fungal nail looks like, and I'll just describe it. So you get a thickened, discolored nail. It can go yellow, it can go brown, the nail can feel very thickened, and it can appear very ridged. You get lots of lines down it. Now, a fungal nail can be really, really difficult to treat because the nail bed grows so slowly. So there are different ways to treat fungal nail. You can use a nail lacquer from the chemist, and you can apply it once or twice the affected nail. That takes a long time, takes about 6 months for fingernails and about 9 months for toenails. If practically that's too hard to do, or if there's no one there to do it, then actually the other thing you can consider is a daily tablet. Now, the tablet again takes a long time to work because the nail bed grows so slowly. And the tablet takes about 6 weeks to 3 months to work if you've got your fingernails affected, and 3 to 6 months to work if you've got your toenails affected by fungus. So it takes a really, really long time. And I didn't know if there was anything else from a podiatry angle you would add to that, Jenny.
Yeah, I've just you've done a very good appraisal there of everything, but yeah, I don't know if I'm allowed to mention brands or anything here, but
go for it.
Yeah, if there's a cream Canistan that you can have for fungal infections, and if it's very, very itchy, you could have one that includes a bit of steroid cream, which is really good. It stops the itching. And something I use myself occasionally because I have difficulty getting down to my feet is an aerosol spray.
Yeah,
it's a skull aerosol spray, so you don't actually have to get down there. You just spray in the general direction and hope for the best, really. But it's a bit easier if you can't get to your feet. And also with fungal infections, I don't think people use so much the antifungal powders these days. I don't think they're particularly effective, but they're quite good for putting inside your slippers and shoes, because it tends to sort of kill off any fungal things that are living inside the slippers and shoes a little bit. I have heard of in the past people with fungal nails. Actually, if it's just isolated in one toe, you could have the toenail and the toe bed removed surgically. Seems quite drastic, but I have heard that being done. Yeah. I can't think of anything more to say about fungal infections.
That's great.
Oh yeah, one thing I have found that's quite good is Lamisil. Lamisil once is you get it in a little tube, and you just rub it all over your feet, and it's really, really effective actually. Just leave it on for 2 or 3 days and then wash your feet, and it's quite a good one-off treatment if you just have the problem occasionally.
That's brilliant. Thank you, Jenny. That's great. That's great. I'll move on to the next question and I'll come back to you again. So I think there was a question about, can you prevent arthritis? And I would say, especially if you're using your legs as arm, or you're using your feet for activities of daily tasks, then you are putting more wear and tear on the joints, and you're therefore making it more likely that there might be some arthritis there. And you can't reverse arthritis once there are changes. So once we've got those changes, although the body does constantly try and repair itself, and you can minimize symptoms. So one thing, we've talked about is getting that assessment with the physio, getting the assessment with the podiatrist, seeing if there's any support, exercises and gait assessment we can do. We've talked a little bit about maintaining good foot health. Now, there are some supplements, but there's mixed evidence for them, but some people have found them helpful, and it's something you might have heard of, glucosamine and chondroitin. And these are natural compounds that are found in healthy cartilage, and that you can actually take these as a supplement. They're generally considered safe. I think there's only one interaction that you need to be really careful of, and that's if you take a blood thinner. So it'd be worth chatting to your chemist or GP about that. But as I said, they're generally safe, and some people have found them helpful to help with the symptoms of arthritis. I don't know if you've got anything to add about that, Jenny, with regards to sort of feet and ankle arthritis.
Well, I think I mean, you get arthritis in the big toe joint. Sometimes if you injure your big toe, I've always sort of recommended having not a completely rigid sole to your shoe, but a fairly rigid sole, so that the shoe isn't sort of too bendy.
Yeah.
And certainly orthotics will sort of help to, if you're having your heel sort of controlled into a certain position, then the rest of the sort of step cycle is going to be better and more stable. So yeah, I don't know how much more to say about that really.
No, that's great. That's really helpful. Yeah, and I think, as I said, hopefully Fraser in the webinar in May will talk about some specific strengthening exercises to look at how we can best support the feet, best support the muscle system around the feet, and the tendons and ligaments. And there was a question actually about what you can do for very dry feet. I don't know actually, Jenny, if you want to kick off on this. I've got a few things, but you're probably a better person to answer this than myself.
Well, I think, after you've sort of washed your feet or been in the shower, whatever, dry them off, and just, if they are dry, just apply a simple moisturizer, as it says there. And sometimes it can get quite thick, the dry skin. So if you've got a long-handled sort of a diamond deb file or something, just to keep the skin from getting too thick around the heels. if you bathe, then I would not recommend using bubble bath or bath salts or anything like that. Things like Radox are very drying. Oh yes, you put their cream with urea. That's quite good for thickened skin. It helps stops sort of callus building up. But I think, you know, you need to have a word with the pharmacist about that, or the GP. Yeah. I don't know how much more to say about that one either.
That's really great. So it's basically it's making sure that the feet are dry and moisturizing sort of regularly. And I guess you can get there's some heel balms if you're getting very dry, cracked heels. I think you can get from the chemist that can really help target the dry, cracked heels. Um, and as I said, as Jenny mentioned, you get the creams with something called urea in, and that's a compound that can help break down very toughened bits of skin. But you might want to get some advice from your GP or pharmacist about that, especially if you've got something like diabetes, just before you use it on the skin. But I would say that the key is moisturize, moisturize, moisturize. And it doesn't need to be a necessary specific foot cream. You'll see them advertised, but just a good emollient used morning and night can really help. So that's, I think.
Could I just add something?
Of course, yeah, jump in.
If the skin isn't dry, I recommend probably not doing that, because you can sort of overcompensate and make the skin too moist, and you might find yourself getting fungal infections. That's, you know, point. So only if it's necessary, I think, really.
Sure. Yeah, that's it. I think that's a good point about fungal, making sure that the skin's not too moist. There was a question as well about fallen arches and flat feet, and I've just put a couple of images up just to sort of, I guess, illustrate what that means. And we've got a natural arch. I'll just try and describe the pictures. We've got a natural arch under the foot. And when we have, I guess, a flat feet, it means more of the base of the foot is in contact with the ground, and it's quite a different appearance. So with fallen arches or flat feet, it's something that we may have had from childhood, or it can develop when one of the tendons that supports the arch under the foot, and it's called I think the posterior tibial tendon, when that tendon becomes weakened or injured, then that arch of the foot can naturally lower over time. And with time, the shape of the foot actually changes, and you can get some symptoms with that. So. And also flat feet are more likely to develop if we're carrying more weight, because that's putting a bit more strain on the tendons. If we've got high blood pressure, because that can affect the blood supply to the tendons, and if we've got conditions like diabetes. And also, just naturally as we age, the tendency of those tendons is to relax and stretch a little bit, and we can become more prone to flat feet or fallen arches. So I think it's a good idea to see sort of a health professional if you've got flat feet, especially if your feet are becoming, painful, stiff, or weak. If you're getting foot and ankle injuries, if you're noticing a problem with your balance, for example, and if you didn't have flat feet before, then it's a good idea just to seek some help. And actually, flat feet are treated by, really good, supportive, well-fitting footwear. You can use ice, after movement if you're getting pain. And you may again want to consult a physiotherapist who can look at the way you're walking and do a gait analysis, because you might be walking slightly differently because of the shape of your feet. There are insoles that you can get to support the arch under the feet, and that might relieve some pressure. And actually, flat feet can occasionally have a knock-on effect on increasing lower limb and back pain, just because it's affecting the way you walk. So again, I think it's a really good idea to seek some advice from a podiatrist, to seek some help from a physio. I don't know if you generally agree with that, Jenny, or
Yes, yes. Yeah, I have some orthotics from my podiatrist, and I think he charges, they're very simple orthotics. He
yeah,
just puts together in a short amount of time, I think about £40 a pair, but they're really good. I couldn't do without them. They're sort of simple arch supports, and on one foot that rolls in more than the other. There's a bit of posting on the inside so that my left foot doesn't pronate as much as the other one. But and yeah, my walking is definitely a lot more stable.
yeah,
And I actually do find it very difficult now to walk around barefoot.
right,
I find I've always got to have something with a little bit of a heel, slippers. But definitely as soon as I sort of get up and come downstairs, I put my shoes on, and that's with my orthotics in, and they stay on for the rest of the day.
yeah,
I can't walk around without, I'm very
yeah,
wobbly without them now. But yeah, and but yes, it's all about maintaining stability really,
yeah.
and relieving pain. So
Absolutely, absolutely, and it's amazing, isn't it? The knock-on effect it can have on other joints, and the knock-on effect it can really have on your gait.
oh yeah, I made a mistake about it. Well, it was during the lockdown. It was coming downstairs. I'd gone up to bed and I came downstairs to get something
Yeah,
that I'd forgotten, and I came downstairs without any slippers on, and my left foot went over, and I injured my knee quite badly, and I'm still getting knock-on effects from that. I was on crutches for 6 weeks or so, but
wow.
because it was lockdown, I really didn't get it investigated. But I was surprised how badly I could injure myself from not having my slippers on that occasion coming downstairs. So
Absolutely. So I think, yeah, if you have got, I think, flat feet and you are noticing it's more of a problem, it's definitely time to seek some advice of that and maybe consider some inserts for the shoes just to support that arch in your feet. Um, so actually, this is a question, Jenny. The difference between a chiropodist and a podiatrist.
well, no difference really, but I think it's a historical thing. When I went to college between 1980 and 1983, and I went to the Chelsea School of Chiropody, it was, and we were all called chiropodists, and we joined the Society of Chiropodists when we qualified. It was just a few years after that, about 3 or 4 years, I think, we started to have our name changed to podiatrist. I think it was really to follow suit with America and perhaps the rest of Europe, really. I did hear some people saying we got confused with chiropractors, but there is no difference. It's a 3-year training I did. It's still 3 years. Now when I did it, it was a diploma in podiatric medicine, I think they called it. But it's a BSc now in podiatry. And if you go to a chiropodist or podiatrist, the title is protected now for the people that have done the 3-year training.
Right.
And they all belong to the Health and Social Care Professions Council, which is highly regulated, and people have to adhere to very strict standards. And they've had a lot of clinical training, a lot of academic training as well. So I think you're safe. They can work in the NHS, or choose to work privately. So yeah, that would be my preferred option always, is to go and see a podiatrist these days.
And is there anything you need to look out? Is there anything you need to look out for, or can you only have that title if you've had that specific training, or is there anything else you need to look out for when you're picking a podiatrist?
Well, I would say to BSc podiatry,
Yep.
they might have on their card a member of the Royal College of Podiatry and HSPC. That's the main thing that shows that, you know, because they don't have, you know, there are foot care people out there that have done, you know, a correspondence course or whatever, you know, 2 weeks practical training and things like that.
Yeah.
But they, as far as I know, they will never be HCPC registered. And yeah, I mean, they're okay, I suppose, if they're just doing nail cutting, but other things do crop up, as you've explained, with the feet. And you know, if you're not properly qualified, things can be missed. And you know, I think you're better off with a podiatrist that's got the correct letters, which would be BSc honours, hopefully podiatry, HTPC, perhaps a little logo, member of the Royal College of Podiatry, basically.
Perfect. Perfect. And I think that was the last question. And as I said, the other couple, I think there were a couple of other questions related to sort of exercise and strengthening, and I will forward those on to Fraser for the webinar in May. But I didn't know if there were any other comments or questions. I noticed Simone's put some really helpful suggestions in the chat box for everybody. But I didn't know if there were anything else you sort of wanted to ask or to discuss.